Christian was doing the ceramic work those days. And finally, this is I want to share my experience, which started all with this one piece of porcelain veneers. And that was back into early 80s. And in this lecture, I just would like to share with you my thoughts, concepts, techniques that I contributed to our profession in my 35 years of dental career. So, while seeing cases like this, even in this huge magnification, it's impossible to detect what is a veneer, which one is a crown, or whatever. It all takes an amazing ceramist, like Christian in this case, to build a crown, copy-paste per se, or in more complicated cases, just working with implants to see that this single tooth, if you're using the right implant, right techniques, right technicians, you can achieve results like this. This is basically copy and paste type of cases. But when it comes to bigger cases like this, we're not only talking about an interdisciplinary approach, but we are also talking about designing the whole stuff. Because if the patients wouldn't like this end result, doesn't matter what you'd spend on placing the implants, augmentations, prepping the teeth, whatsoever. So, talking about smile design, this is my case. This is my case in mid-80s and my very, very first veneer case. And when we look at it with the face, that was the outcome. And the unfortunate thing is that this is the patient which we have seen like 5 years ago. He's still happy with this smile. The thing is, in 80s, there was nothing such as seeing the thing before we start. So I was thinking, well, I'm just prepping the teeth, sending it to the lab, and this is what I get. I thought that was it. But I was thinking on the other side that even in a simplistic architectural design, they were giving you some plans, they were giving you some 3D sketches, and through that, I said, why don't I apply this into the mouth? I was doing direct composites those days, and I said, instead of just bonding them, why don't I just place it over the mouth, see the final design, and continue with that? So, this brought us step by step over the years to my three steps, which without them, I would never ever touch any veneer case. So the first step was the direct mock-up. I realized that if I deliver this to the patient, then I will have a base to start to my cases. So setting the incisal edge, designing this as a direct mock-up, immediately I would accomplish my step one. So what was step two? Step two was to convert this in a more finer design through the wax up. So when I would have this wax up, this would bring me into my second huge step at those years, as I named it as the APT, the aesthetic pre-evaluative temporaries, which refers to, instead of using this just for the provisionals, using this well in advance before we start the case. So with my final design, I would be able to share with the patient the final outcome, the design, the phonetics, occlusion, whatever you name, and get the approval of all these things, and then start to my treatment. And at that stage, this is before the patient is anesthetized, before we even touch the teeth. So that brought me to the third step, which I believe most of you are using, is that out of this APT, besides the aesthetic check, what I came up as an idea was to why not keep it there when we start prepping the teeth. So doing this, I would use that APT as a very solid reference and start prepping it, and that would give me the most minimal invasive occasion to finalize my preps. And as you can see here, in some parts we don't even touch the tooth, and in some other parts there are some very minimal preparation with this technique. So prepping through the APT, being minimally invasive, always getting the right depth for the technician to layer up the ceramics. In this case, we're using the Emax with an incisor layering technique. Christian was doing the ceramic work those days. And finally, this is what I came out with, the 3 basic ideas until early 2000s. And with the book we published, The Science and Art of Porcelain and Laminate Veneers, I incorporated all this knowledge into this book. So after that, how did we proceed? Well, basically, we should have a workflow, either digital or analog, but we should have a workflow. So it starts with the collection of data, the communication between the patient and the dentist, the design part, and then the rest is like more technical treatment planning and treatment itself. So for me, amongst these all things, treatment session, number 1 goes into where the design is, step 1. Step 2 is in between treatment planning and treatment. And step 3 is the prep part, is during the treatment session. But what I will focus today, as of the whole lecture, is what we did throughout the years with that mock-up. So first things first, it's all about visualization before we start the case. And we cannot just talk to the patient that I'll do this like this, I'll give you triangular shaped teeth, I'll make your teeth more longer. It just sounds, but we have to show it to make her see and believe in what we're doing. As an analogy, let's say you want to order flowers to someone. Okay, so pure. But when it comes to details, you'll see that there are thousands of different shapes in flowers. And besides that, if I want to be more specific, I can tell you that there's a flower purple and orange inside. Can you imagine it before seeing these pictures? Or if I tell you there's a flower that looks like a bird and another one white but transparent, what does it mean to you until you see that these are the flowers? So take those like individual tooth shape that you want to incorporate into your smile design. And on top of that, are we done with this? No. Besides that, now we have the full configuration, how to bring them all together. So this, in a way, is the way we create our smile designs. So I would say never start any procedure without visualizing the final result. And that holds true with simple veneer cases, complex implant cases. See where you're heading to before you start. Another issue is that seeing is completely different than just looking. The more knowledge you have, the more you will start seeing things in depth, the details, and all this stuff. 5 before cases. They all have their aesthetic problems of their own. And these are the 5 afters of these cases. So why did I select these cases? Because it all created this wow effect in those patients. They loved it for some reason. And now in the bottom, you'll see the afters of these cases. Well, nice. We've all been seeing these cases, beautiful cases, in this week. But now when we want to focus on that, tell me honestly, how many of us paid attention to the incisal edge configuration, whether it be rounded, triangular, or flat? Or the tooth axis, whether it be straight or inclined. and then the dominance of the centrals, the individual tooth shapes. So as you can see, in a split of a second, I can tell you so many variables that creates a smile design. So the question here is that how to decide on what to choose. Well, that make us think about it over the past 15 years, and this part which I shared with the friends amongst us in Hawaii is that we took this as a reference, the personality traits of Hippocrates being strong, dynamic, delicate, and calm, and then followed by Carl Jung's theory of that no matter what the background of these people are, their religions, cultures, whatever, there are some signs which means the same all around the world, such as the vertical lines representing strength and power, horizontal lines, stability, inclined lines, dynamism, and rounded lines, suavity. So the interesting thing was that even those were categorized on the same 4 models: strong, dynamic, delicate, and calm. And in the psychoanalysis vision, these are the figures that represent these outcomes. It's not our finding, it was already in the literature. And then Philip Holloway was the guy who converted into an art form, and he used these shapes for those faces to be perceived as strong, dynamic, delicate, or calm. So when he would use a square face, this personality means, or perceived to be as a strong facial outcome. So he came out with this visagism concept, and on top of that, when we follow the same lines, we can see that this also can be seen in the individual teeth. We can have all these designs and the teeth disposition when we analyze the smiles. So our concept was a combination of the visual language that Carl Jung came out, combined with the perception portion of how we can implement this into the faces or into the smiles, and at the end, its reflection on our smile designs. Now, as you can see, visagism is all about a person's sense of identity. Now, you see a male on the left and a female on the right, but I would tell you that this is the same person with a different way of presenting himself. So you can have something perceived completely different depending on the person's wishes. Look at these pictures and the other sides. So they are almost completely different, but this is all about how a person wants to be perceived. And in a smile design, now it's in our hands to deliver this kind of a perception to our patients, if they want to look strong, dynamic, calm, whatever. And for this project to go on, we consulted lots of psychologists, neurobiologists, anthropologists, and sociologists, and tried to find out the relationship between the facial outcome, personality, and the design of our smiles. And of course, we made lots of mistakes, or trial and errors. To be creative, you have to do it. But the art form is knowing which ones to keep. So with that, we came with the art of a personalized smile design, which will perfectly fit to this patient's desires. Our project started with Braulio and Adriano back in 2004. Out of the 600 plus full mouth cases we have done, we selected like 100 plus of wow effect created the smiles. We put them into fragments and tried to find out the relationship between all these things I mentioned in the beginning of my lecture. So which patients get flat incisal edges, which patients get rounded, which patients get triangular tooth, which patients get square teeth. So with that, we came out with a chart after 12 years, which all get this whole information together and their relationship between the facial analysis, the personality of the patient, and their wishes.